I really appreciate that. So, because we're a nice small group, I'm going to invite you guys to ask questions. Please interrupt as you'd like. You can chat. In other words, it doesn't have to be a formal talk-at-you presentation. I have, as you see, slides prepared, and I was going to do a really technical presentation on healthy community design, but I thought it'd be much more fun to show you my vacation slides. So, why not? You know, you can never capture people. You're a captive audience. You've come for the food, obviously, but that's all right. I'm okay with that. And indeed, I invite you to go help them refill your plates, help yourselves, because there's plenty back there. And I'm not entirely kidding. I actually am nominally calling this talk three lessons I've learned on the trail, because I do a lot of hiking. And in fact, I have a good friend who lives in town here. His name's Michael Lanza. Does anybody know that name? If you're involved with education reform at all, he's been involved in that, the big referendum and some of that recall. So he's that guy. But he happens to be an avid backpacker and hiker. He's an editor for Backpacking Magazine. And so we've known each other for a lot of years. I used to work at a magazine called Walking. It was a health and fitness magazine, literally a couple decades ago. Point is, I ran into him, so I knew him as a writer. We have since taken up to doing these hikes together. And every year or two, he comes up with an insane idea. We ought to do this. It would make for a great story in the magazine. And inevitably, those become sort of epiphanal moments for me. And I'm not making this up when I say they've helped me sort of get cogent some of the key lessons I have about healthy community design, which I have really strong feelings about. I've been in this game now for 25, 30 years, and I'm highly opinionated. But because I'm an engineer by training, I also try to make an evidence-based argument. So that's what I'd like to do, is share with you these three big epiphanal moments. I'll, in so doing, be able to share a couple of my hike slides with you, mostly just to kind of get me to my point. And I'd like to make an evidence-based argument, because hopefully if you're the kind of person that comes out to a public meeting like this, you're a local advocate or activist, or you're engaged in some way in these topics, right? You care about this. If you care enough to blow off a gorgeous evening like this, which I really appreciate that you came despite that. So what I'd like to do is help equip you for those conversations. So let me tell you about hike number one. Hike number one, in a minute I'm going to ask you to introduce yourself, but we'll get to that in a second. Just to set the context. His idea a couple of years ago was the year we were turning 50, in fact, was let's see if we can hike 50 miles nonstop. And he picked a kind of a classic, an iconic hike called the Zion Traverse. It's a hike across Zion National Park from the northwest to the southeast corner, basically. Is anybody familiar? You guys ever been to Zion National Park in Utah? So it's pretty spectacular country, it's amazing, and normally people would do that as about a 3-day backpacking trip. Because we do these sort of, we want some suspense, it makes for a good story in his magazine or his website. Can we do it nonstop, 50 miles, 50 years old? Can we do it at that age? So we started about 3 in the morning at the Lee Pass Trailhead. Here we are. These are the three lessons that I'm going to share with you that sort of come from some of this work. One is the real risks that our children face. Let's make sure we're clear on that, because we should be all telling everybody we know about what we should really be nervous about regarding our kids' well-being, or our grandkids, or the children in our world. 2, it's not about me or you. The kind of person who would show up at a meeting like this, or who does this work, is probably not the big problem that we face. Let's think about the people who aren't in this meeting, are really the ones we have to help build a dialogue with around these topics. 3, it is about the environment. It's not about us, but it is about this environment that we've created and that we maintain, the real world. And that has to do with what I call stickiness. And then I'm going to sort of implore you to think about how you can be part of the change. So having said that, we're continuing on our Zion hike. We're about 31 miles into it, 4 in the afternoon. We're making good time. We're on target for an 11 p.m. or a midnight finish. It gets us our 50 miles in under 20 hours, which is our target time. My wife and daughter are, bless their souls, avid hikers too, but on this one they weren't coming with, but rather going to intercept us at a couple points with food resupply, so we could hike with very small packs, water, things like that. You know, we really tried to pare it down. That's one of the keys to these. We find it's much easier on your feet if you pound them to just be carrying a lot less. So there's a great view from the West Rim Trail. One of the exciting things was there's a thing called Angel's Landing, which is this high pinnacle of rock that's kind of an out and back mile. And it's very, very steep-sided. And my daughter, 13 I think at the time, maybe even 12, 13, said, Dad, I'm thinking I'm going to try to do Angel's Landing with you. I want to meet you at the base of it, and we'll hike out. And I said, look, don't feel compelled. I would love to do it with you. That's going to be at mile 37. Well, we get to mile 37, and she says, I'm ready to go. I'm ready to do it. And at mile 37, you're pretty trashed. After starting at 3 in the morning, you're already going. You've been cranking over, rugged terrain. That buoyed me up. And in fact, the highlight of my trip was not, quite honestly, making the 50 miles in 20 hours, which we managed to do. It was that she went out and wanted to do Angel's Landing with me. And you can see that's the National Park Service puts that sign up there. Strenuous climb, narrow route, hazardous during thunderstorms. You really shouldn't be doing this at all. That's essentially what they're saying. It's very dangerous. She's scrambling out there, and here we are. There it is. That's the Angel's Landing, that pinnacle there. And it really is. That at some point you're on like an area that's, well, it's about 6 feet wide, and that's a 1,000-foot drop right there. They put in what's called fixed protection, so you don't use ropes because they put in protection that's always there, chains and posts driven into the rock and so on. That would be my wife behind her, pretending to smile but thinking, what have you done, you foolish man? You're going to kill our daughter and maybe me too. She would have been perfectly happy if I fell off, but she would have been really angry. My daughter, meanwhile, is having a great time. She thinks it's a riot. This is her on one of the steeper and very precarious sections. I mean, it's really gnarly. So I'll tell people this story, and if I'm speaking to a bunch of health advocates, for example, they will inevitably say, what kind of irresponsible parent are you exposing your child to that risk? And that's actually the whole point of my story. Is that really the greatest risk she faces? And indeed, if she is, for me, the euphemism for a generation, I would argue that's not the greatest risk they face. That arguably is going to sound self-serving. She's really lucky to have parents that are into the outdoors and active and get her engaged and stuff like that. And indeed, she's part of a generation that faces a much graver risk than this, right? They face really, really bad risks around chronic disease that I would never have expected this generation to have to take on. Which leads me to the real point of our conversation. Okay? So I want you to do me a little favor, if you would. Now we're going to jump to those introductions, because I want to know who you are, and I want you to think back to your own youth. And what I'd like you to do is tell me your name, what your job is, or whatever it is that brought you here, but we're not looking for a soliloquy, really quick, and your earliest fond recollection of being physically active as a youngster. Earliest recollection, physical activity when you were a little kid. Got what I'm saying? So I'm not talking about being on a high school sports team. I'm going to play your memory tapes back as far as you can. And it's going to all tie together. You've got to trust me. And I want you to do this in 6 seconds each. I'm not looking for a paragraph. I want to respect your time. So it's name, job, early fond recollection of being physically active as a little kid. Everybody understand my 3 things? Got it? Yes? Okay, go.
Scott Oliver. I'm starting a new job next week, and my earliest memory is walking to the bus.
Excellent. Perfect. He did it just right. 6 seconds.
I'm Megan Larson. I work for Compass, and I remember playing Ghost in the Graveyard with my older buddies.
Great.
My name is Liz Paul, and my job is to protect the Boise River, the cornerstone of our community health. And my earlier memory is learning to swim in our neighbor's outdoor pool.
Excellent.
Janie Burns, farmer and local food activist,
Okay.
playing with the dog outside.
Excellent.
We're still we're set St. Luke's, and I'd say rolling down hills with oak leaves on them.
Nice. I like it.
Joanne Graff, I work at the Central District Health Department as a tobacco policy analyst, and playing Red Rover.
Come over. Send Joanne over.
Lisa Johnson, I'm a legal secretary and a realtor, and I remember doing gymnastics in the morning.
Nice.
I'm Aubrey. I'm interested in studying urban regional planning, and one of my earliest memories is racing my brother up the hill on his back.
Sharon Publer, Secretary of Wax, we talked about trails. Earliest memory, always wanted to go, as I told my parents, health club.
Good.
Jennifer Tripp, Program Manager at Southwest District Health. And I guess earliest memory maybe hiking around the Oahu's with my family. Just like and stuff.
Good.
I'm Rod Bunya with Keller Associates, doing the transportation planning and engineering. Early memory of kind of chasing some spawning fish at Portofino Creek.
Splash
Kind
on
of
the water.
falling into the creek.
Sure.
My name is Brett Danielson. I work as a land use planner at Ada County, and my earliest physical memory would have been playing tag with my brother.
Sure.
My name is Crystal Hayes. I'm the events coordinator back at Treasure Valley, and my earliest memory is playing around on a jungle gym in school.
Good.
My name is Matt Hayes. I'm a teacher, and my earliest memory is riding bikes around town with my friends.
I'm Bob Taunton. I'm a development consultant, and I'm here representing the Land Institute. My earliest recollection is playing football with a very small football.
I'm Lisa with Compass, and my memory is riding my bike with friends to the lake.
I'm Chris Danley. I'm a transportation consultant here. My earliest is probably zipping up and down sidewalks on like the coolest awesome. It's a big wheel you've ever seen.
Yeah. Good. We're just saying who we are, name, what you do, what your early recollection of being physically active is.
Oh, well, I'm Dawn Irons, I'm the Central District Health Department, and
You gotta say one, Matt.
Matt Stahl, Compass, running around a small town with my friends.
Amy Left with Compass, and I would say riding my tricycle in a bicycle parade. I was the first one, and the second the parade started, everybody else went zooming past me, and I ended up at last.
So I'm going to make a couple of points about our observations. You'll notice that we largely talked about things that did not occur at a scheduled time and place, didn't require a uniform or an umpire or a referee or even necessarily an adult. In fact, some of the things you were doing, I suggest you could not have gotten away with if an adult had been involved. If you really think back to that time in your life, you know, that hill was a little too steep maybe for you kids to be rolling down. And you're not supposed to be in that water right now, and certainly shouldn't be in that drainage canal or that whatever irrigation canal, playing around that. And sort of the question I ask as we have this conversation with a room full of adults, I say, how many of you remember would describe yourself to some degree or another as a free-range kid, having been a free-range kid? How many would say you had a certain amount of free-range responsibility, that you could like disappear on a Saturday morning at a certain age with your friends on bicycles and be told to come home at dinner, or when the streetlights came on, or if you were going out and playing in the yard or somebody's yard? Are those familiar memories to most of you in one degree or another? So then the question it leads to is this: how many of you believe the majority of kids today in America, today, are free-range kids, honestly? Not so much. And then the last question is, how many think it's good for their health that they're not free-range? I think most people would agree, probably not that great. If you hear about a childhood obesity epidemic, it doesn't seem it seems likely that not being free-range is probably not helping that. And indeed, lots of real experts have said that's exactly the case. Richard Liu wrote a book called Last Child in the Woods. I commend it to your attention if you've never read it. You guys familiar with it? Some of you are. Really compelling. He makes an argument, and again, an evidence-based argument. He looks at a lot of the data on everything from childhood obesity to ADHD, and he asks a lot of very interesting questions. The woman quoted in the bottom is a child health advocate from Australia who spoke up when I was at their National Physical Activity Conference, said, I don't think it's just physical, I think there may be developmental challenges. If kids don't spend time outdoors, when do they get the inventiveness and creativity of making up games, or the leadership skills of being a captain and picking teams, or the negotiation skills of dealing with it when there's no grown-up to tell them what the rules are, right? All the skills you use in adulthood that you started developing when you were 6, running around the neighborhood, and, you know, dealing with, including, by the way, getting scratched and boom and all the other stuff and making good judgment. If we ask parents, of course, why they can't let people do this, why they can't let their kids be free range. So I walked to school from 4th grade on alone or with friends, but never with an adult. What do most adults say? When we ask parents, why don't you let your kid walk to school? Why can't your kid take off on a Saturday on a bike? What's the answer?
It's too dangerous.
Not safe. As I said to the folks earlier today, there are creepy, scary men with big, thick mustaches hiding behind every tree. The mustache men are out there ready to sweep our kids away. Unless you think I'm making light, I got a 15-year-old daughter and a 17-year-old son, the daughter that I showed you climbing on the hill there. I'm very careful about where they are and when and who they're with, and I know there are streets they shouldn't be on. I get that those are issues. But one of the reasons I serve on my local planning board for 6 years is because I believe my job is not to throw my hands up in despair, but actually to do something about it. If I think there's an unsafe street, I should be part of the positive change that makes it safer so my kids can be free range. Just to be very clear, if you ask the question, has it actually gotten more dangerous out in the real world over the last 30 years? For example, our childhood abductions or violent crime against kids by people who don't know them any worse now than 30 years ago? Does anybody know the answer to that?
No, it's not.
Turns out, even over the time span, when the percentage of kids walking and bicycling to school, the green bars here, went from 40% to only about 15%, while the percentage of kids being driven to school every day went from about 15% to almost 50%. So think about that. Just 30 years, from 1970 to 2000, we almost reversed how we got our kids to school. Got in the habit of throwing them in the back seat of the cars for everything. What we did not see was a massive increase in violent crime against kids. That's not what was going on. The thing that was going on is that childhood obesity rates were tripling. We can overlay those two graphs. We know those things are absolutely coincident, and I would argue they're causative. In other words, there's a causal relation. As kids were being routinely physically active, not necessarily doing even less sports, less PE, although those kinds of things have happened too over that time span. But even as they were just being less free range, this is what we did to them. And that's a pretty frightening thing. In other words, I am happy to say to the people who work on this stuff, if they challenge me, that There's no coincidence in that. That is not just a coincidence that those two things are related. So now we're talking about an obesity epidemic, which I think is actually the wrong thing to talk about. Because we really should talk about the underlying behaviors, because it's a lot more than obesity. There's a disease that we used to call adult onset diabetes. My colleagues in health here will now know we can't use that term anymore. We use the clinical term, type 2 diabetes. Why don't we use adult onset anymore, Joanne?
Because children.
We've seen it in 8-year-olds, right? I mean, we're seeing it in an age where we thought it was, when I got into the field, physiologically impossible. We didn't think a kid could get this disease. We didn't think the physiology worked that way. Now we see it in 10-year-olds. We have school nurses having been trained how to do glucose measurement, right? And how to, I mean, none of this is news to those of you that work in health. So, but this is a dramatic change. When I talk to transportation planners and so on, they're sort of like, are you serious? This has really happened that abruptly, 30 years? And the answer is yes, right? Public health people, confirm for me that I'm not making any of this up. Well, I think we should be talking about the underlying behavioral epidemics, because I think the things that drive this are poor nutrition and physical inactivity. That's what the data tell us. We have all sorts of evidence that there have been pretty dramatic changes, and indeed, I think we should change the conversation, because here's the problem. As long as we keep talking about an obesity epidemic, so this is one of my first bits of advice to you as community advocates. I'm saying, let's change the conversation. If somebody wants to talk obesity, say, let's talk about the actual real epidemics, which are physical inactivity and poor nutrition. Because first, when we talk about obesity, I think people's inclination is to say, well, when are they going to come up with the leptin drug, you know, the miracle drug that's going to fix it? Or when am I heavy enough for bariatric surgery? In other words, we're into treating that problem, rather than the underlying behaviors. Second, and this is important, we know that physical activity and nutrition are independent risk factors. So if I can get a person to be a little more physically active and to eat a better diet, they will live a longer, healthier life, even if their weight does not change dramatically. The data is very strong on this, by the way. If you want, I can talk more about it. But we know that they operate independently, as well as the combined influence on obesity risk. Does everybody understand what I just said there? So if you've got an overweight person in your life, a friend, a parent, whatever, and you're worried that they've been struggling with the whole, lose weight, then regain it, lose it. If you could help them just stop thinking about the weight altogether and say, let's talk about being physically active, eating a good diet, and let the weight get to its natural point, you're really doing them a big favor. Questions on this? Anybody from health want to add or sort of enlighten anything that I've missed on the point here? Okay, this is important because if you talk about what's driving up healthcare costs in our country, those are two of the risk factors that are driving the bus. So if you care about healthcare, and the third, by the way, of course, is tobacco. So if you think about the three big risk factors that fill 80% of the hospital beds with chronic disease, those are the three. We do something about that and forget whether you like single payer or Obamacare or a market-based system. None of that matters. You'll be actually dealing with the underlying problem, which is that we're getting sicker and we're costing more, irrelevant of how we try to pay for it. Okay, I'm going to admit a unique perspective on this. I'm going to largely talk about the physical activity side of the equation, not because it's more important than nutrition, I do that work all the time, but it's sort of relevant to our work at Compass, right? So I'm tying it to land use planning and transportation quite specifically. But the other thing is because I have a background specifically around physical activity, I actually worked at the U.S. Olympic Training Center, I worked at Reebok's Human Performance Lab for a while, I'm sort of an exercise nerd, and I used to be a competitive athlete in frankly, I'm going to admit this to you, the weirdest of all events in track and field. So my question to you, your first quiz of the night, what's the goofiest looking sport that they do in track and field? It would be speed walking or race walking. She said it very kindly, but she said it and she's right. So I used to be a competitive race walker. There's photographic evidence that I really did used to do it. Proof that, as you can tell, it was a very long time ago, given the fact that it was only black and we only had black and white photography there. That's all they had. Like one of those things that flashed. It was actually. And the second thing is that those shorts were in style when I was competing. I swear to God. This was, of course, the 1928 National Championship that I'm showing you. And many people ask, why race walking? Of all the events, if you're a decent endurance athlete, why were you a race walker? It's obvious when I show you the next slide, which is, of course, the huge crowds that showed up at our competition. And I'm not making this up. This is true. This is the start of the 1984 Olympic trials in the 50-kilometer race walk. Now 50 kilometers is 31 miles. It's the longest foot race in the Olympics by 5 miles. And just like with the marathon runners, what you do is you start on the stadium track, then you go out and you do a loop in the city. In this case, Los Angeles. The 84 games were hosted in LA. Then you come back and finish on the track. You come through a tunnel. And that's what they do with the marathon runners. Joni Benoit finished right on that very track, actually. And it was very thrilling. When we finished at about 10 in the morning, the other events were going on. The stadium was packed. They announced your name, Greater Boston Track Club. It was really cool. But at 6 in the morning, you have to look very, very closely. And if you do, you can see My mom and dad, right up there. And I swear that's really them. Way to go, sweetheart. Look at her. She's like this. Just 30 miles to go, honey. You look great. Thanks, Mom. So so I've got this background in exercise science, and I actually came from that world where we all thought, remember after Frank Shorter won the Olympic marathon in Munich, well, the running boom, and then there was the aerobics boom, and the bicycling boom, and when Billy Koch won the medals in the cross-country skiing in the Olympics, everybody's going to be a cross-country skier. We've had these booms, right? And then Chris Everett's going to be tennis, swimming, sure. Well, they've all been booms. How are we doing as far as our population? Do you know the answer? As far as actually making progress and getting more Americans physically active.
There's more Americans, so you're talking percentage.
Give me a percentage. Are we doing better or not? You know what I'm saying, and you know I'm right. We're doing miserably. And in fact, that leads me to my second point.
How miserably are we doing?
I'm going to tell you in a moment, and you're going to be sad when you hear the answer.
Do you have Kleenex?
No, you're going to just have to suck it up and deal. Here's the real problem with a room full of people like you. We've got this figured out, and like me, by the way. So the second of Mike's grand ideas, actually this one might have been before, was let's hike the Grand Canyon from rim to rim to rim, south rim, north rim, and back. I don't know if you're aware, the rim to rim is sort of a big adventure. Sometimes people try to do that in a day. Rarely people try to do this in a day. It's 44 miles, it's, as you see, about 11,000 feet of elevation here. That's actually the North Rim Trail. There are places where it's literally 1,000 feet here, 1,000 feet there, and you're on a trail that's 5 feet wide. Gorgeous, by the way, stunning. How many of you think that might be a cool thing to try to do? Hands up if you would be intrigued. How about just walking from the rim to the river and back? Would that be cool? Okay, good. So the point is, you're still a vanishingly small percentage of the population at large. And that's my point. If we use our perspective as we think about this problem, it is completely irrelevant to the vast majority of the people that we're trying to influence. And you need to understand this. Because we forget that although we, this room full of people, come in here thinking about being active in physical activity and nutrition, because it's sort of central to sort of our personas, maybe our professions, right? I'm not trying to be unkind. It's great. I love it. You're my peeps. We're kindred spirits. We are also, if we draw the bell curve of the distribution of people's interest in this stuff, and the vast majority of Americans are here, we're 3 or 4 standard deviations over here to the we care about this stuff category. Because I can boil the public health data on physical activity, for example, down to 3 numbers: 30, 20, and 365. Be ready to weep. 30 is the percentage of minutes, is the number of minutes per day we're told we should be physically active as a minimum. The actual recommendation is 150 minutes a week, but divide by 5 days a week. If you got 5 days, half-hour walk, you'd be meeting the minimum recommendation. By the way, kids need more like 300 minutes a week or an hour a day. These are bare minimum recommendations, but they at least reduce your risk for chronic disease in an early death. 20, sadly, is an overestimate of the percentage of Americans that actually get that daily physical activity on any kind of a regular basis. 20% is a generous estimate. 365, you would assume, of course, is days of the year that we should be active, right? Sadly, you can add 3 zeros and you have an estimate of the number of premature deaths annually in the United States due to physical inactivity and poor nutrition as the root cause. It may manifest as cardiovascular disease and stroke, the complications of diabetes, high blood pressure, but it's because you were physically inactive and poor nutrition. They can do that based on what are called relative risk ratios, looking at the data, but the bottom line is, the only thing that kills more Americans prematurely, and the last time they ran these numbers was 2000, so it's old data, was tobacco at 400,000 deaths per year. And here's the scary part. Tobacco deaths have plateaued and are beginning to drop because you guys have been so effective, while inactivity and poor nutrition deaths could keep going up. The next time they run these numbers, the #1 cause of premature death in American society will be physical inactivity and poor nutrition, or the so-called obesity epidemic. So that's the bad news, and let me amplify it a little more. Although the guidelines tell us that 150 minutes doesn't even have to be formal structured exercise. These women walking around downtown Boise, doing errands, shopping, walking to and from school. If it's accumulated 30 minutes of activity, walk your kid to school 10 minutes in the morning, go walk for errands at lunchtime for 10 minutes, walk home for 10 in the evening. 30 minutes, you gain the benefit of reduced risk for essentially everything that kills us prematurely now. Cardiovascular disease, type 2 diabetes, obesity. How about things like dementia and old age, or a growing list of cancers? That's the good news. The bad news is that 20% number. The yellow line here, this is about a 20-year time span. The data that the Centers for Disease Control collects, and let me tell you 2 really important things about this graph. #1, that's an overestimate because it's based on telephone survey data. And when people are on the phone with you, they tend to tell you what you want to hear. When they've done validation studies and actually put pedometers on people, they find that that number is much closer to 5 to 10%. that actually, so people think they're more active, but they confuse being busy with actually being physically active. A busy day at work, lots of meetings, I was on the phone constantly, is not the same as actually moving. Everybody understand that? So that number is probably more like 5% of society. And number 2, it's dead flat. Whatever we've been doing for the last 20 years has not worked. Simply telling people to exercise and eat a better diet is not sufficient. It may be a necessary condition for success, but it's not a sufficient condition for success. I'm not telling you that to bum you out. If you're a person that's out there doing health fairs and encouragement programs and education, I get it. It's great. I'm part of that too. It's not enough. That's my simple point. And you're shaking your head. You know that. You do this work and you're saying, I know it's not enough. Why? My last point about this. If you look at the exercise intervention trials, let's just look at one kind of data, and I really promise this will be the end of the public health, but it's important to know this. This is a standard study that tried to get people for 6 months to walk more, 40 minutes a day basically. They were trying, they said you could break, one group was told you could even break it into 4 10-minute walks. One of the groups in the study, they even put a treadmill in their house, and they said jump on the treadmill anytime you're. So they're making it as easy as possible. You know, with the 6-month intervention period, they call them on the phone, they send them email reminders, they teach them how to warm up before, how to stretch afterwards, how to select a good walking shoe. They give them an exercise diary. They say, if you give us to fill out the page and turn it in, we'll give you a prize, like a t-shirt or a water bottle or a coffee mug, because that's what we do in health promotion. We give out t-shirts and water bottles and coffee mugs and baseball hats and pedometers and fanny packs, right? I mean, those of you in health promotion. And by the way, those of us in transportation do it too on Bike to Work Week. We give out bagels and coffee and little backpacks, right? We love events. Why? Because when we're doing them, exercise minutes per week, which is the vertical axis here, actually goes up. But that's not the interesting question. From a public health standpoint, what I want to know is, a year later, after I've gotten you engaged, and by the way, in this study that the guy named John Jakisik did, they even measured statistically significant increases in aerobic fitness and decreases in weight in 6 months. So walking the 40 minutes a day was helping people lose weight and get more fit, aerobically fit, measurably. Even given all that, look what happens to their behavior a year later. Drops back off. It doesn't stick if all you do is behavior change. We have nice anecdotal examples. You can tell me the person you know who lost 70 pounds, who's off their diabetes meds, who lowered their cholesterol. That's great. They're an outlier. If you look at, again, the middle of the curve, the average for these types of intervention trials, this is what we see. By the way, the weight loss research is the same. This is weight loss over time, right? And by the way, it compares being in a self-help program to being in Weight Watchers, the yellow line. Even in Weight Watchers, after about 6 months, people tend to regain. And again, I'm not knocking Weight Watchers, it's wonderful, but it says there's a deeper problem here, and that we can't just focus on the individual. Are you crying yet?
No.
No, but you buy my argument.
Well,
You want to think telling people works.
No, that's
Okay.
definitely not my
Okay, good.
My argument, my question is, well, so, it's not like nobody died premature death in 1920.
Right. Why is it worse
You
now?
know, is it worse now?
It is worse now. It's vastly worse now. Yep.
And I go back, to bigger problems than
I do too.
physical inactivity and nutrition.
Oh, well, you could talk about big social demographic shifts and stuff like that, but we're going to take one piece. We're going to take one wedge of the pie for tonight's conversation. Yeah, exactly. Because we could talk about population growth. There's so many things we could go down the road if we wanted. Let's talk about what do we know does work if you want to do population behavior change. And what the researchers will tell you is you can focus on the individual, but it's not enough. You have to take what's called a socio-ecological approach. And that means you have to operate at other levels. You have to have other influences in the individual's life, like their family and friends, like their workplace or their school or their health provider, the city or the town or the community by its physical design, even public policy. That this pyramid sort of reflects all of the influences, and there's a case to be made that if you think about this as a pyramid, and I were to ask you, which of these are the easier things to do? Run a 16-week walking program or change your zoning ordinance to make sure every subdivision has sidewalks in it? Which one is easier to do, honestly? Sure. That's all the health people in here have done, 16-week walking programs, right? I can't tell you the number of t-shirts I've given away at those. That's the easy stuff. Where's the greater impact? Change the physical environment, right? We know that. We have experience with this. We know that if you only if you're including the base level of the pyramid, the actual sort of, if you will, broader social determinants and policy determinants of behavior. Okay, none of this should be shocking. And indeed, we have examples. You could give me a couple right now. Think about healthy behaviors or sort of behaviors in our society that we have shifted by taking a full ecological approach, all these levels, not just focusing on the individual. I actually am asking you for a couple of examples. You give me the first one. Uses the whole model. How have we changed a social behavior, a social norm around an unhealthy behavior using this model? It's your job. What do you do? What do you work on?
Work on smoke-free.
Tobacco control, right? Would you agree that we've shifted the norm, not just by telling people, don't smoke, it's bad for you. We make it hard to smoke in public places. We've taxed the daylights out of the product. We don't advertise it on television anymore. We enforced the ban on the sales to minors. We've made a major change in sort of the entire social norm around tobacco use. I, as a competitive athlete, had to ask for a non-smoking seat on an airplane. And that meant I might be 2 rows in front of somebody who was in the smoking section. Is anybody else old enough to remember this? And the air doesn't move. It was fine. I was smoking secondhand smoke all the way to the track and field championships. Right? My kids who are 15 and 17 will never experience that. Not because when I get on a plane I say to people, hey, would you mind not smoking? It'd be really nice if we have kids on a plane. That wouldn't work, would it? The law says you can't smoke on airplanes. The pilot can land in another city and have cops drag them off. Right? The flight attendants can actually have that happen. I'm not making this up. Everybody understands what I'm saying, right? We've made it a policy. Give me another example. Seatbelt and child safety restraints, absolutely. So tobacco for sure, changing the norms, but also seatbelts and child safety restraints. Got any others? I'm going to suggest here's an odd one that's out there, recycling. There are environmental health benefits of that. There are 4 bins back there. They make it, that's an environmental change. We don't just say try to recycle, take your plastic bottle home in your pocket. We say I'm going to make it easy for you. And indeed, we've changed the pricing on our waste streams and so on. Right? Policy level, environmental change. And I'm going to give you one other one that we don't talk about very much, but I think is ultimately relevant. I don't know if you're aware of this. Haiti is still undergoing a cholera epidemic right now. They're still suffering a pretty horrible epidemic. It's pretty bad. And they thought for a period about trying to vaccinate and so on. But in the end, what are they going to have to do? If they're going to break the back of this epidemic in Haiti, what have they got to build? Meaningful sanitation systems, right? And they've got to separate. Do we see cholera outbreaks very commonly in the United States? Indeed, would we expect to see an epidemic like that in the United States? Why not? And I mean specifically, what have we done procedurally so that that doesn't happen?
We have drinking water regulations passed by Congress that are enforced nationwide.
Actual laws. And then states turn those into literally design regulations and so on that I, as a member of a local planning board, am empowered to use regulatory power. In other words, I can refuse giving a permit to a developer if they don't meet those standards of performance for both stormwater and sanitary sewer or septic systems, whatever the appropriate. But those laws detail what is and is not possible, correct? We have regulatory power. It's exhaustive, by the way, the amount of review that a local planning board in my community, at least in Massachusetts, we spend a lot of time on that. Sometimes we'll hire a third-party engineer to review that the developer may well have to pay for to make sure that that all meets standards. We don't, and if a developer happened to come in and say, we're just coming out of a recession, times are tight, we're really trying to get the economy going again, wonder if you would give us a variance on this subdivision, we'd like to go with open pit toilets rather than connected to sewer. Are you okay with that? Give us the variance. Probably going to say no, right? Same developer comes to me and says, just coming out of a recession, times are tight, cash is a little strapped, we want to get this subdivision up and running. Could you give us a variance on that requirement for sidewalks and the requirement that you put in that we had tied to the nearby bike trail system? That's going to cost us a lot extra. Would you give us a variance? What do we often say in the United States? Sure. Oh, you'd be stunned how often I hear that that's a yes around the country. Now, I'm not arguing that that's the case here. Maybe all of your planning boards and commissions are very clear about that stuff. You can tell me sort of where you feel they come down on that. I'm amazed how often we'll say, yeah, or just put the sidewalk on one side. Especially when they make the case, it attaches to a road that doesn't have a sidewalk on it. Miles and miles of it. So why should we have to build one in the subdivision? By the way, does anybody have a logical answer to that developer? What might one say to the developer? Yes, I know it attaches to a road that doesn't have a sidewalk on it, but you should still build yours. Why? Is there any logical argument?
I guess you can say in the future, this road will probably have a sidewalk, and we want to make sure that your sidewalk is in place so it can connect to the new sidewalk when it gets built.
So we have a long-term plan or a vision for this community. We are attempting to build a network. We'll never have a network if we continue to say no. So we're building the network, and we're starting with these pieces that we're building now. And indeed, you're right. When we can do it opportunistically, when we dig that road up for sewer or for whatever other reason, we're going to get a sidewalk on it. And the kids in this subdivision will be able to access that if we put it in now. And if we don't, they never will. By the way, they also can walk around within the subdivision on it. You know, they can ride bicycles in here and all of those. So we have to be prepared to have those conversations because those are actually gnarly conversations in some cases.
Well, do we have more or less sidewalks in 2013 than we did in 1950?
More or less. Well,
I mean, I would argue that we have more sidewalks than ever.
no, not even remotely.
I mean,
we went through a 20-year period, 65 to 85, where we were building miles and miles of subdivision roadways without them. Miles and miles. Huge volumes. You guys have got to have some around here that you can take pictures of. And I didn't go and seek them out, because then we kind of got back on it. But there was a long period where we were indifferent to them.
That's what I'm saying. I think that there's more.
With or without sidewalks?
With. I mean, so you think there was sidewalks that were built in the early half of the 20th century?
Think about the oldest
I mean,
neighborhood.
I
Think
grew
about
up
the
in a
north.
neighborhood that didn't have sidewalks everywhere. I didn't stop me from getting out.
But you're the outlier. Did you not hear point number 2?
But everybody,
No.
everybody back then, you're saying that everybody
Right.
55 years ago was out and about, free ranging. I mean,
Well, a lot more than
much
now.
more than that.
Right. Traffic volumes were lower, speeds were slower, vehicles were smaller, right? I mean, it's a dramatically different world.
That's okay.
And I think the perception in this area, you know, with the big boom starting in the late 80s to the 90s, almost all new construction had sidewalks. But if you look at prior to that, I lived in a subdivision from the 50s and 60s, doesn't have sidewalk. Look at the Meridian interchange. How do kids get from Overland to Meridian? There's no sidewalk across that. So if
The
you look
major
at-
arterials
Right.
were sort of, and then if they had a sidewalk, it was sort of a curb edge. I mean, you know, there's that classic problem too. So yeah, we stuck one on, but it's at the curbside. It's a 55 mile, it's a 45 mile an hour posted road where real speeds are 55 or 60 and you're 2 feet away from a car. So, you know, sidewalk is my euphemism for sort of appropriate pedestrian facility, proper separation, all of that. So, by the way, does social ecology work? Let's just ask that question. Is there any evidence that public health people can tell us this socio-ecological approach, that the environmental factors combined with behavior change, remember the pyramid, works? Tobacco, again, the data on that is, I think, compelling. In that, when you look at this graph of per capita cigarette consumption over the last 100 years, way back in the 50s and 50s, we were telling people your cigarettes kill you without a dramatic reduction in the behavior. This happens, the downward trend happens when we engaged in the policy level change, taxing the product, secondhand smoke laws, banning the sales to minor, trying to reduce the addiction to nicotine in the first place. So I think that it's sort of one of the examples that public health uses to make the case for a socio-ecological approach, and it's a compelling one to me. Questions on that? Good? Okay. So that's why I put that in. Which leads me to sort of the realization that came on my third of my crazy trips that I did with Mike. This one was an attempt to hike the John Muir Trail, which is a 220-mile trail roughly through the High Sierra, starting at Yellowstone National Park in the north, goes to Mount Whitney in the south. What's that?
Yosemite.
Sorry, Yosemite, not Yellowstone, thank you. It's one of the Y parks. Yosemite in the north, through Tuolumne Meadows, then you go down through Kings Canyon and Sequoia National Park, through the Ansel Adams Wilderness, all of that, and you end up at Whitney in the south. 220-ish miles. And his idea, to make some suspense, was could you do it in a week? People were kind of getting into this movement called fast packing, super lightweight packs. So you carry so much less that walking, in this case 30 miles a day, might seem plausible. It was a completely foolish idea, largely because you're going too fast to really enjoy how stunning the country is. But it's amazing. And if you're the kind of person that only can get a week of vacation to do something like this, there'd be one way to go. Not my first choice. I would go back. But here's my real point. How do you get up on day 6 when your feet are pulp and you're exhausted and you're really thinking, boy, I am ready to be done? I would argue, knowing that over the next pass will be another view that looks like an Ansel Adams photo, helped a lot. The environment was a very compelling piece of the thing that pulled us through. Now that's extraordinarily, again, it's kind of the rarefied example that would, on the surface of it, not seem to be entirely relevant to our conversation. But it reminds us that perhaps there's a case to be made that it is the environment that matters, and it is a more macro environment, not the micro environment of do I have a gym in my workplace or a treadmill in my basement, which you could think was the answer, but if you remember from like that study I showed you where they put treadmills in people's houses, the behavior still dropped off. We don't have reason to believe that microenvironment alone can satisfy it. We start to ask questions about the macro environment, bike parking, wide sidewalk, things like that. Do those things matter, which is sort of the question that's being asked. If we build it, will they come? And my short answer is yes. So I'm going to give you guys a quiz. to see whether you buy my argument and or have some knowledge about this stuff. I'm going to tell you a little story about a workshop we were doing in a town called Swift Current, Saskatchewan. They had a province-wide physical activity campaign. We went and did community workshops. We were up here in Swift Current in February, so it's really cold. I'm going to tell you the story of these two pictures, and then I want you guys to tell me 10 attributes that you see of the what we call socio-ecological environment that encourages physical activity. Okay? So you may be catching some already. Here's what we saw. I'm in a neighborhood, residential neighborhood, the picture on the top. This is largely residential, but there is a little corner store right here. And this kid came walking down the street, went in the store, came out, was munching something, so he'd gotten a snack, put something in those things. Those are mailboxes in Canada. They're red, not blue. So he bought some postage, put it in there. He then walks down the street. You'll notice he has a hockey stick, he has a backpack. In it are his skates. He then went to this little neighborhood ice sheet, of which there are in fact two, one here, one here. This larger one has boards around it. The older kids, the teenagers are playing here. The younger kids are playing here. It's freezing cold. I mean freezing cold out. Negative 2,000 and whatever degrees they use up there, Celsius or, no, but it was really cold, seriously. So I've told you 10 things. I mean, I've told you the story. Tell me 10 things that suggest the social ecology of that community is supportive of physical activity. Go for it. Just throw them out if you've got them.
Neighborhood store.
So there's a neighborhood store.
No grown-ups.
No sign of adults. Excellent.
The sidewalk, the whole stretch is
Clear.
very inviting and clear.
Yeah, he's got a sidewalk. A, he's got a sidewalk, and B, it's been cleared in the winter. Good?
Lights on the.
That's right, there are lights here, so they can play in the evening. Remember, we're up in Saskatchewan. It gets dark at, I don't know, 2 in the afternoon. but it does. It does get dark early in the winter.
Looks like in the neighborhood they have a place to play, so that's
Yeah.
like a park or a rink or.
This is not at the big centralized sports complex with 5,000 acres of parking surrounding another 5,000 acres of playing fields, which are all soccer and giant arenas. In other words, this is a little distributed neighborhood parklet, if you will, that has 2 ice sheets on it. Not even regulation size. Obviously, that's smaller than a full rink. Doesn't seem to be stopping them from playing. So neighborhood availability of that facility. Good. Any other things strike you about it?
There's some city maintenance or some kind of maintenance going on for the sidewalks, which has been mentioned, that somebody self-sufficient.
Somebody scraped the ice. It could have been the parents, could have been the kids themselves, but there was a shovel available. Somebody's taken the lead on that. Excellent. Maybe it's the park district, who knows, but it doesn't matter. It's happening. I mean, that's what matters. I don't know if I have any others, other than I would point this out. You might not pick this up, you probably wouldn't. That's an alleyway back there. So these garages are facing back toward an alley. So it's a classic sort of, part of the grid in the north end of town, you see that, where the alleys, and what you end up with what I call big wheel sidewalks, because if all the garages face back, it means that every house doesn't have a driveway cutting the sidewalk, so you have an undisturbed sidewalk for the full block length, which is a great sidewalk for my, say, 74-year-old mom. It means it's that many fewer curb cuts she's got to navigate. It means that a parent might let a kid ride a big wheel up and down because there's no worry that he's going to get backed over. So backloading like that. It also does things like move the utility poles, trash cans. They tend to reside on the alley, meaning, again, you have a much cleaner, undisturbed sidewalk. It's a little thing, but it is an urban form that we're seeing. Actually, some developers, even some communities, are writing zoning to support that, or development guidelines, subdivision regs, and we're seeing some developers choose to go back that way because some people are finding that appealing. Chris?
I was going to say one other thing, you touched that it's unorganized, but the fact that it is unorganized, what we can't tell is there might be a kid in there that otherwise can't afford to play in an organized league. And so therefore, there's an opportunity for somebody who's, a little lower on the socioeconomic ladder.
I asked that question, they said, right, no membership fee, and they said, the one thing you can find, any kid in Canada can find a pair of skates, because you grow out of them, so kids are constantly handing them down. So that's not, I said, there aren't skates a barrier to entry, and they said, they're so ubiquitous in Canada that I mean, I thought they were kidding me, but they said, no, really, that's actually not the big problem. And the other thing, though, is that households have the hats, the gloves, the coats, yeah, the gear. That's exactly right. Yeah. Good, so good observations. So I think we said everything that I did back out of the
Wear the
garage.
same clothes for walking to the.
To store, to school, to the friends. Right. Corner store, we talked about the fact that there's mail there, do the errand for mom, really cold day. And of course, the first point you made, that there were no adults obvious. I think there's a sort of a strong implication there. Somebody thinks it's safe enough for kids to be out doing this stuff, right? So that may be one of the most important takeaways, this idea that it is, in fact, safe enough for our kids to walk down the street and play on the local rink. So cool. So it still leaves us with this question, what are the attributes? If we build it, can we lead? I mean, is that an anecdote, or do we have some evidence? And my short answer is, I read this research literature very closely, and it shows up in several different arenas, planning journals, transportation, and increasingly public health. So the American Journal of Preventive Medicine, American Journal of Public Health have articles with titles like Environmental Determinants of Routine Walking and Bicycling Behavior, which I know sounds enthralling, but it's the stuff that actually does case comparison. Does having a sidewalk versus not actually change the likelihood that somebody's going to walk? Does having a corner store nearby or other destinations, proximity to a school, a park, a playground, do those? And the short answer is yes. The slightly longer answer is, if you ask me to read the research and sort of summarize for you, 4 things are characterized by environments where we see more routine physical activity. 2 references that you might look at if this stuff interests you. One is the Community Guide to Preventive Services published by the Centers for Disease Control. That's it right there, the citation for the website. I'll give you another one in a moment. But the 4 things are this. 1, a greater variety of different kinds of destinations in proximity. 2, they are well connected by facilities such as trails and sidewalks and bike lanes and so on. 3, when you get to, and transit, by the way, transit is a part of the active transportation network. 3, when you get to the destination, it rewards you rather than punishes you for showing up without a car. Let me say that again. It doesn't punish you for not coming in a car. 4, it's safe and accessible for all potential users. The pedestrian, the bicyclist, the person who is of any age, any physical ability or disability. So if you've designed it right, it serves everybody. Okay? So that's the research, and I can illustrate it with lots of photos, particularly from Boise proper, but from the greater region too. By the way, the planners among you would say, oh yeah, we talk about this stuff at our conferences all the time. You go to a planning conference, there are sessions on health impacts of planning, right? I mean, we're speaking at those all the time, do workshops. But we talk about land use mix, comprehensiveness of the network for all 4 modes, functional site design, universal access. That's planner language. The other is sort of public health language, the same stuff. We're talking about the 4 basic things that show up in the research. And again, to illustrate, what we tend to see is much higher levels of routine physical activity in compact neighborhoods, so where there's shared green space, whether it's a linear green space like a green belt or neighborhood corner parks and things like that, as opposed to each individual home having a large yard, which tends to spread things out and lengthen distances rather than shorten them. Proximity of things like schools, shopping, post office, the utilitarian trips nearby. Many people describe this as having live, work, shop, play, learn, pray in proximity versus spread out. Simplistic, but it's a way to picture it. And keep in mind, many people say that sounds good for New York City or Boston, where I'm from the Boston area. What about small towns? If you think about Main Street America, the smallest towns, historically they had these attributes. There would be a main street that often had retail on the first floor, may well have had housing above, store owners often lived above their own shop, or others, there might have been businesses up there. There'd be a common green that had the church, or a couple of churches that might have had the school, post office, bank, town hall. They were all very proximate. Right? So I'm not making this up, and yes, indeed, small town America, rural Idaho, might have seen that still in their village centers, right? That would have been typical. Second, network of facilities. Yes, the mundane stuff like sidewalks, bike lanes, but multi-use trails like your greenbelt and transit. And I'll again reiterate this. The research does suggest regular transit riders, irrelevant of any other conscious exercise they choose to do or not do. Setting that aside, if you control for that, they still get more daily physical activity, and they're statistically more likely to get the 30 minutes a day or a significant portion thereof by virtue of their use of transit. Is that shocking to anybody? The other interesting thing is that tends to preferentially benefit lower income members of the community because they tend to be more regular transit riders. So you see more low income folks gaining a substantial portion of daily physical activity through transit use. So if health equity is an issue for you, building a viable transit system becomes one of the tools in the toolkit. So I just put that to you. Third, site design. I can show pictures like these all over the United States. I can take the picture in any community, the old Main Street or the downtown, the core, versus the new strip development out on the edge. And I say, which seems more appealing for the bicyclist and pedestrian. And inevitably, people will pick the picture on the lower left, and they'll say it's things like the building near the street, trees, awnings, benches, water fountains, bicycle parking. Now I show you a Walgreens from Portland, Oregon. I told the guys earlier today, I use Walgreens because I can find them everywhere. They're ubiquitous. And they're kind of an indicator species for me. They tell me about the level of engagement of a community. So that's Portland, Oregon, where the building is up at the street, right? There are benches right here that serve, those are benches that serve a transit stop that's right here. There are awnings or an overhang protecting those benches. Bike parking is just out of view here. The automobile parking is a small lot, visually screened. The entrance here actually faces the pedestrian way, that is the sidewalk, not just the parking lot. So these are very different than the standard Walgreens, right? Walgreens comes in with a standard format, but you would say, Mark, that's fine, because it's Portland, Oregon, which everybody knows is a communist enclave. A bunch of commies live there, they do this wacky stuff, they get that. You're in Idaho, where we're Americans, and we have the standard Walgreens, right? And I could get a lot of pictures of sort of on a corner, multiple curb cuts, building setback, parking is the primary architectural feature, you know, it's the first thing you see separating you. Maybe there's a walkway to the front door, maybe not. Maybe there's a bike rack, maybe not, depends. And this is common, by the way. I'm not knocking anybody. That's the standard thing, right? That's what Walgreens' standard template is. If you want economic development, you say yes, bring it in, right? And indeed, by the way, there's a new Walgreens near the Whole Food on, where it's near Myrtle and Park, I think. Is that familiar to anybody? Where the building actually abuts the street, and there's nice bike parking, and the Walgreens developer, I believe, helped to improve a sort of a pocket park space on the backside of the building that adjoins a transit stop. I have those photos. We looked at them earlier today. I didn't stick them in this presentation only because I just didn't have time. But it's an example of sort of evolving the conversation, right? But you might tell me, yeah, but City of Boise is the communist enclave of Idaho. And I defer to you on that. But there are those who would say you're the Madison, Wisconsin of, because, and I use Wisconsin advisedly, here's Neenah, Wisconsin, which is not the socialist enclave of Wisconsin. It's out in the middle of the state. And they got the standard Walgreens. But here's the point of the story. Appleton, Wisconsin, which is next door, and also not a socialist enclave, got that one. And that Walgreens is up at the street, and they did do pedestrian scale lighting and street trees and bicycle parking. And the reason was because they wanted to maintain the character of their main street. And they said, we want the Walgreens to respect the other buildings on it, and we think it will be better. It'll be a better Walgreens. You, Mr. Walgreens developer guy or woman, but you, Mr. Store owner, will actually do better with the Walgreens design this way. And to their credit, if Walgreens said, no, we're leaving, we have a standard template, which they have done, by the way, over the years in some occasions. We have a standard template, and if you're not willing to let us build that, we'll take our development down the road. What did the town have to be willing to say? Go for it. Good luck. We're sorry you're not here, and it would make it much easier, I would argue, for their elected and appointed officials if they got support when they were going to do that. Because frankly, if they're just going to get excoriated in the newspaper for undermining economic development in our community, then that's a disaster, because they're not going to make that vote the second time. They're going to just say yes. Here's the interesting point I need to make about this. I was considered a pro-development guy on my planning board, not an anti-development guy, because I would never say we don't want Walgreens. I would say I'd like to have a conversation with Walgreens and figure out, would any of these things or others help them make the economics work for the design that we're working for? Do they want to put a second story on and put some housing in there? Maybe we can find a way to, sort of accommodate that. In fact, we put overlay districts in some of our development areas to allow for second story residential in what was historically just commercial development area, so that if that made the economics work better, we could make it fly for the developer. But I was going to insist on that kind of a design, a pedestrian bike transit oriented design. Questions on what we're talking about here? This is kind of geeky, but it's actually where the game is now, I believe. Changing the conversation around development practices. Chris, go.
I mean, just the point of it is, there's always these places in the community that you point to that you do like, that are good places. And the point being is that at some point, a developer build that too.
Yeah.
And so,
they're not the bad guys.
Yeah, so it's just a matter of, like you said, figuring it out.
Right, and working with the development community, if that's who's developing it, or the city, and sometimes there's a joint public-private ventures. There are a lot of different ways stuff gets built. But to sort of say that the person who wants to build a wrong Walgreens is automatically the enemy, or a Walmart, for example. I mean, sort of you can go up and down the scale of size. Again, I use Walgreens largely because I can find interesting examples from all over the country of different approaches where communities have worked differently with the local folks and had different levels of success. Okay, let me jump to number 4, which is essentially safety. Because I can have all this other stuff. I can have the store can be close to where I live, mix of land uses. There can be a sidewalk that gets me there, I've got a network. It can be designed in such a way that it invites me. The building's up near the street. I can get to the front door without having to play Frogger through a parking lot. All that's great. But if I feel like I can't just get across the street, right, or I'm going to get hit by a car at the the one crossing I have to make, I'm still not going to do it. But here's where I'm going to defend my discipline, my fellow engineers. They have a lot of good tools in the toolkit now, and they're doing really innovative, creative stuff to build places where pedestrians can cross, yes, even 4 lanes of traffic, using roundabouts, and even simple things like curb extensions where the sidewalk bumps out and therefore allows the pedestrian there to see beyond the parked vehicles, more likely to be seen by the car. The crossing distance is shortened. Okay, so those are all nice design attributes. The bottom line is we have to ask our engineering staff, our road designers and builders to do this. If we don't, if all we say is move more cars faster, you'll get what you have a lot of in the Treasure Valley, which is big wide roads with lots of lanes and double left turns and all sorts of things that are really unpleasant for a bicyclist or a pedestrian, and in some cases very dangerous. But if we say, could we design this in such a way to work for a transit stop and a pedestrian crossing and bicyclists as well as motor vehicles, we know how to do that. Am I overstating that, or would you?
I would agree.
I mean, the discipline has evolved a lot in the last decade or so.
It's been focused on capacity, movement.
And we even built measures that rewarded that.
But I think the trend is to look at more livable communities and kind of design that to the community fabric for what you're trying to accomplish.
Yeah. So the good news is the tools are in the toolkit. I'll give a good example, actually. So one of the examples I give, because this is just sort of an intuitive one, you don't have to be a technician to sort of get this. This is called diagonal parking. And interestingly enough, I saw some in downtown Nampa, I saw some in Caldwell. Any of the old main streets historically were wide enough for a big team of 4 and to be able to turn around. So you had this width, so they put in diagonal parking in the modern era. But Meridian has some, and even there are some spots in downtown Boise. There are problems with that, though. First of all, are you comfortable riding a bike behind that? If we're trying to promote bicycling, do bicyclists like to ride behind diagonal parking? You're always worried you're going to get backed into. And I'll go a step further. Do you actually like driving there? Do you like backing out? You're nervous when you're backing out. And one more thing. If you open the back doors here, when I pull in and my kids are in the back seat and I open the door, which direction do the kids tend to go? Think about it. The door is between them and the road, and them and the sidewalk. They actually tend to back out into the road. And when my mom or my wife or me goes to put groceries in the trunk, where am I standing? I'm out in the road. How could I solve those problems and still get the density of parking that diagonal gives? Because diagonal parking is about half again as many vehicles, as much as even twice as many, than parallel parking. Make it back in, she says the crazy woman in the front row. Reverse diagonal parking. But lest you think it's crazy, there's a sign, and there's an example where Des Moines, Iowa has indeed made it their standard now. They had just done one of their first projects. You see, they just scribed out the center line. And now think about it. Open the car doors, where do the kids go? This is important because I think it's one of the hidden advantages. You open the back doors, kids can't get out into the street. The door's between them and the road. I go to put the groceries in the trunk, where am I standing? On the sidewalk, and when I go to pull out, I'm actually looking at the bicyclist I'm not going to kill now. Yeah, so that all sounds great. And holy mackerel, if I didn't actually see some of it in downtown Boise on 80. So it must be the communist enclave, obviously, if they're putting it in there. But it was really interesting to see it, and there's a cyclist happily riding in front of it. This guy on the adjoining street, this is on the perpendicular street right there. It's not Grove, it's the next street down, I can't remember. He's so excited about it, he's backing in on the conventional diagonal parking. He thinks it's such a great idea. I don't know what he was doing, if he was coming down the street on the opposite side, and then he backed across the lane, I'm thinking.
He was racing for that spot.
He wanted it. He saw a guy coming up the street in the direction we're going. He said, I gotta beat him, so he just boom, backed right across his lane. But anyway, so I thought that was funny. So you're trying to, it's a wonderful treatment for a main street. Here's the real point of my story. I have mentioned this in towns from Peoria, Illinois to Hutchinson, Kansas. Note I did not say Boulder, Colorado to Portland, Oregon. Not talking the enclaves, talking regular towns. What's one of the first reactions people have when you put this out there, honestly? Say it again, won't work here. That's exactly, won't work here. And why not? What do you think they're saying, honestly? We're different. Our drivers can't do that. We got a lot of, this is a common one, got a lot of older drivers. We got a lot of retirees in our community. They won't be able to do that. To which I ask them, I look them straight in the eye and go, so I guess if you've got people that can't make the reverse maneuver and back in, that means if they can't back into an empty parking space, they sure as blazes shouldn't be backing out onto an active travel lane. So I presume you're taking out all of your diagonal parking next week, right? That's what you're telling me? Well, no, we're not saying, well, what are you saying? What you're saying is it's change and you're afraid of change and it's scary and you don't want to do it. But if the data is there, it tells us lower severity of collisions, you should actually be doing it. My real point in this is that our job is to try to make evidence-based arguments. And I look to my public health colleagues, because that's what we had to do when we recommended actually vaccinating people with the weakened smallpox virus. People say, you're going to put the thing that kills us in my child's arm? I don't think so. right? Seriously. So what do we have to do? We have to do an education campaign, we have to build the case, we have to do surveillance and build the evidence. And essentially we changed the conversation. We understood universal vaccination had the benefit that we would all. We're going to have to change the conversation about whether the wacky idea is this or striping bike lanes or whatever it is to an evidence base, because we have emotional reactions. It happens all the time. If I'm asking you to do one thing, it is to broaden the reach of those who will join the conversation and bring a rational 100 and then 500 that sort of say that. Let's make an evidence-based argument for free-range communities for our kids, which is what these 4 attributes really design. Okay, Mark, it's all well and good for the cities. We got a lot of rural landscape in Canyon County, or Ada for that matter. I mean, sort of it's not all city and town. I don't think any of this is relevant to that. I'm going to make a strong case to you it's where it's most relevant. I would suggest that if you look at population trends, this is from Robert Putnam's very good book called Bowling Alone, and he looked at population trends, and we see this tremendous drop in our rural population over the last several decades. And it was not replaced by people moving into cities, it was a growth in the suburban population, the red line. And it was not because people consciously said, I want to move to suburbia per se, because I'd love to live in a community where every trip has to be by car, or I can't even walk my kid to school anymore. It's essentially the reality that suburbia oozed out of our cities and towns and consumed the surrounding landscape, and that became where a huge percentage of our population, now almost half, lives. Everybody see that with the graphic there? And I would go so far as to say, nobody consciously said we wanted to turn this stuff into, that we wanted to turn, sort of our fields into fields of houses and the Boise foothills into, sort of curlicue cul-de-sac subdivision. Nobody consciously said that's our best choice for that land. It sort of just happened, sometimes through lack of, sort of conscious thought and planning and oversight. And maybe some people said they wanted that. But I think communities are really rethinking this. And it is at the urban edge or in the rural environments where actually thinking about this stuff and making conscious decisions is most important. So if somebody says, these rules are fine for the urban setting, less relevant for rural, I'd say, on the contrary, at least make what you do in the undeveloped parts of Canyon and Ada counties be a conscious decision, not an accident of indifference. Because to not decide, to just allow the zoning changes to go, convert from agriculture to residential and let somebody put up another 300-house subdivision without really thinking about it, that has implications, vast ones, arguably. Questions on the point I'm making here? I mean, I know some of you do this very work, so you get that, but we need to be telling everybody that sort of, you end up with Fairview Avenue not by accident, but by a series of decisions that may have had unintended consequences, but suddenly there it is. It's a giant sprawling avenue with all these big setback retail and horrible left turn challenges and all the things that go with that in a road you don't even want to drive on anywhere near 4 o'clock in the afternoon. It is what it is now. So here's my other resource. Where do I find the articles that bear this out? ActiveLivingResearch.org. It's maintained by the University of California, San Diego, funded by the Robert Wood Johnson Foundation. You can literally put in at that website trails and physical activity, or sidewalks and routine walking, and find out if there are recent articles on that. So it's a pretty good resource for this kind of stuff. ActiveLivingResearch.org. Those are my 5 elements. I added healthy, affordable food. We could do an entire seminar on that. We will not tonight. But there's, you can talk about the environmental determinants, proximity of community gardens, local farming, whether you have an urban agriculture or zoning ordinance that allows for backyard chickens and beekeeping and compost. I mean, literally all of those are part of the much more, whether you zone for fast food or not. Literally, Los Angeles County has put in a moratorium. They're not giving out permits for any more fast food because they found that they had plenty, given the density of the population, and they mostly congregated, surprise, surprise, in their lowest income communities, where the highest risk of obesity, type 2 diabetes, and hypertension prevails. So they said, we're not giving any more permits. That's the worst thing we can do to our most at-risk residents. So they're using zoning tools for the nutrition side of the equation too, not just the physical activity side, which is, I think, powerful. I mean, that's gutsy, and they're doing it. Okay, questions so far? And let me leave you with a couple of parting thoughts. I think we have to speak up, act up, and step up. The very fact that you're here tells me you're people who get this and care, but I'm going to implore you to take this message to others. If each of us found 5 others to be an advocate for this stuff, to show up at a public meeting, it would make a huge difference. So speaking up is, let's change the conversation. Let's remind, it's not just an obesity epidemic. Let's talk about those underlying epidemics, inactivity, poor nutrition. Help remind the most frustrated person we know who's saying, I've been struggling with my weight for 15 years, say, stop thinking about it. Think about getting 30 minutes of physical activity every day and just eating a little bit better diet. Let the other stuff come later. Right now, try to get that 30 minutes. And if you can't get 30, by the way, there's data that tells us somebody who gets 10 minutes of physical activity a day is better off than someone who gets 0. So there's what we call a dose response. So 10 minutes is better than 0, 20 better than 10, 30 better than 20, as far as reducing your risk for chronic disease and an early death. So let's change that conversation. And in so doing, let's be advocates for real change. And the change that I'd love to see, I captured in an article I did for the journal Childhood Obesity, which I think should be Childhood Physical Activity and Nutrition, but that's a different conversation. I've let the editors know that. And I said so in the article, actually. So they were very cool. They published me nonetheless. And I said, if you were to ask me sort of, this is what it was. It was an invited review article, and they said, tell us what you think is happening in the movement around physical activity that's the novel, the cutting edge. So I didn't tell them about walking programs and people giving out pedometers and exercise classes. I told them about these 5 trends that I think are influencing sort of the landscape, if you will, the social ecology of physical activity, like the changes we made in the tobacco world. Planning and zoning, complete streets, transportation trails, transit and bike-friendly communities, policies, and comprehensive safe routes to school. How many have heard the term complete streets? Is that familiar to everybody in the room here? Okay, good. So let me just talk quickly about this. I'm imploring people to show up at the meetings where we do the permitting for this stuff. In school boards, by the way, I'm not kidding when I say this notion of continuing to consolidate schools and move them out to the edge so that every kid gets there by some kind of motorized vehicle, that is a damning trend, because those are sometimes 40 and 50-year decisions. You know, that school's going to be there for decades. So we really have to jump on that. We need to be vocal. But corner stores and so on, I mean, do we really want to keep permitting this? This is the Kmart, which I could take any of a million pictures. We drove this road between Nampa and Caldwell called the Boulevard, I think, or something like that. Is that it? And it's just, it is a model of suburban sprawl that could have been outside Houston or San Antonio or any of the places that make me cry in America. And you have it here in the Treasure Valley, and it bummed me out because I think of you as cooler than that. but I get it. I understand. No, it's everywhere. I don't mean that. I hope that didn't sound even remotely judgmental or. It's just you've done so many great things in the region here, but it's so hard to overcome the momentum that led us to this. So there it is out there. I show this picture of a Barnes & Noble in Terre Haute, Indiana. Because that Barnes & Noble, they've got their own strip out on the edge. That's where that Barnes & Noble could have ended up. But to the credit of the community, they said, we'd really like that to be downtown. Why don't you become the Indiana State University bookstore, do it down, and go multi-story, and let us put offices or apartments above. We'll put in, they've created an overlay zoning district. We'll make it really easy for you to do that. But they still had to convince, but Barnes & Noble said yeah, to their credit, right? So they've built the path. They said, we're not going to make it, you don't have to get a special permit to do this. We'll make this easy, expedite your permit if you do it this way. And they got it. The point is, we're having different conversations with the very businesses that historically went out in those locations. They kind of get it, that it's a different model now too. They're interested in a new model, I believe. You work with the ULI, you can tell me if you think I'm totally blowing smoke here. Right? I mean, the conversation is different, isn't it, than a decade ago even. Remember that Compass right now is doing an update to the long-range transportation plan. Essentially, that's what Communities in Motion is. It's your regional transportation plan. They're updating it for 2040. They've already had sort of some visioning exercises, but you're going to continue to have public meetings and public review, lots of discussion opportunities. I implore you to get involved, and here's the real thing I would love you to do. Get some people who have never been to one of these kind of meetings to show up at some of them. Get a mom who pushes a kid in a stroller, somebody who rides a bike because the economic means they have, that's all they have for transportation. In other words, let's broaden the conversation. People who use transit, get them into the conversation so that this document, this 2040 plan, really has an eye toward this. I would argue, and I put to the board today, I got to address Compass board thanks to the staff here, I make the case that we should be thinking about health impact assessments being built into how we make our transportation planning decisions. So look at the health impacts of the decisions we make. I think there was some interest. I got a vibe that the room did not totally think that we were full of baloney. Matt, tell me if I'm totally full of it here. There was some receptiveness to it. Now, it would be even more so if the public, during public comment, supported that idea. That looking at health outcomes should be a piece of how we make our transportation planning decisions. Everybody understand what I'm saying? It would be even better if not just the 20 people who show up at meetings anyway show up, because yeah, she always comes. We know she's going to talk about that. But if we get some new faces in those conversations, I'm going to say this 12 times before you leave. 2, complete streets. So you've got this unique scenario, Matt, and we were just talking about it beforehand, where you've got a county level, essentially, public works department that's responsible for the roadways. They need to hear that complete streets should not just be conceptual, but it needs to be practically implemented. And I would argue, even in the most mundane things, like when we're doing routine paving and painting and so on. So it's really cool to look at these kinds of projects like 8th Street downtown, right? That's all great, and I love it and everything. But the really interesting question is, it's also sort of rarefied air. Right? That's sort of the unique, okay, we can have a special thing, it's right in the core, communist enclave, all of that. What about all these roads out here, like Chittenden, I think it's called, posted 35 miles an hour. Has anybody ever seen a car going 35 on that road? Other than when there's bottleneck traffic that actually forces that? No, I mean, it's just, there's nothing about that design that says 35, even though that's what the little sign says. And you've got, I'm stunned at the communities I visited, just, again, Nampa, Caldwell, Boise here, Meridian. How many multi-lane one-way streets? What were one-way streets? What was the very premise of the multi-lane one-way street when we put them in the urban environment? Why would we do that? Say it again? Move the cars faster, get them in at 5 in the morning, 8 in the morning, and then back out to the suburbs at 5 at night. So we could evacuate downtown. So I mean, it was at the heart of the death of Detroit, and we emulated that nationwide, right? Turn all these great boulevards that used to have trolley tracks in the middle of them into giant one-ways that allow us to move lots of car in quickly in the morning and out quickly in the afternoon. I'm not being facetious. That was the design intent. You can get a high level of service on a big one-way road. They're not particularly pleasant to cross as a pedestrian. They're not friendly to bicyclists because of the speed that's invited. Trying to make a left, you got to cross multiple lanes. I mean, there are lots of reasons. Communities across the country are reevaluating these kinds of roads and saying, is that really what we want? That, though boring, could be at the heart of complete streets improvements in this region. Looking at which of those are ready for reversions back to two-way to feel like the local and regional streets they should be. Questions on that one? Complete streets. By the way, another big thing that's happening is what are called lane realignments on sort of multi-lane roads. This is a 4-lane to Urbana, Illinois, same road afterwards. The road was given what is now being called more and more a diet. Have you guys heard that term, road diet? Is that a familiar term? So it's kind of it's a popular term now in sort of the vernacular, and I'm even hearing engineers start to use it. We're calling them road diets, even traffic engineers. The idea is this. You'll notice this guy's kind of doing the classic straddle here. And they do that because if the guy in the right lane suddenly turns right or a bus stops, you want to be able to jump left. But if somebody makes a left from the left lane, you want to be able to jump right. So you get this effect, which is actually very inefficient, causes collisions. There's a very common collision, which is the one where I turn to the right to get around the stopped vehicle and cause a collision in the right lane. That collision just doesn't happen here because the turning vehicles move into a center turn lane. And in so doing, reducing from 4 lanes to 3, I've got room now for bike lanes on either side and a nice median island for pedestrians to cross up there. How dandy is that? The traffic engineer here said they were moving just as many cars, level of service is just as good, and they're having fewer collisions. They don't get those rear ends and those lane change collisions, and they now have dramatically improved the level of service for bicyclists and pedestrians. So those road diets are no longer just a wacky idea. The only reason I mention it is because you got a lot of roads where I think you could rethink whether, paint might make the change. The reason I mention it is because in some cases, they're not exceptionally costly changes, and they can be done opportunistically when we're repaving, when we're out doing work anyway. Now that's not always the case. If you've got to move signal lights and things, it can get, there can be costs associated. So it's not just the cost of paint always. But in some cases it is, interestingly. There are some times where it's not an exceptionally costly change. So I'm giving you examples because many people hear this stuff and they think everything's going to be $1 million. And that's not always the case. Third, trails. I'm a trail fan. I love them. I love the Greenbelt. The thing that I love most about the Greenbelt was the number of people I saw when I was out riding on it at 7:30 this morning who were commuting on it. I love recreational exercise riders. That's great. I love if you take your bike and drive up to the foothills and go mountain biking. That's all good. But man, what I really love is you're eliminating a car trip and you're riding your bike to get somewhere instead. And you're getting your 30 minutes as a part of your daily trip because that's just how you get around now. And I believe that's how we should be building our trail networks. The focus of trail work should be making the connectors that turn something like your Greenbelt into essentially a spine route with all sorts of spurs that make it highly functional for transportation, not just recreation. And by the way, that means when we go to add to the trail, this is a nice trail in Boone, North Carolina, where see all these kids there walking from school to a nearby park connected by the trail where they have a cross-country meet. And the cool thing that I learned was that school doesn't have to sign a bus out for the cross-country. Or in fact, when any of the teams have a sport, there are soccer fields in the same park too. So when the sports teams go to play sports in that they use the trail in lieu of a bus, right? And those kids do the walk over to the field, to the cross-country course as part of their warm-up. It's just sort of, that's the model. You know, that's sort of the dream. If we could. By the way, we talk about putting a trail in your backyard, and you scream bloody murder. By God, the mustache men will be on the trail. It will be a horrifying thing. The NIMBYs, right? You know what the NIMBYs are, not in my backyard. Do you know what the bananas are? They're the people who say, build absolutely nothing anywhere near anything. They don't want it. And do you know who the caveman is? He is the citizen against virtually everything. And he just wants to show up at my meeting when I was chairman of the planning board to spit venom at whatever we propose. My real point is, what we need to do is make sure we have so many people in the room talking about the benefits of the trail that that person looks like the outlier that they are. Because typically they are. They're vocal, and they can make a lot of noise, and they can be the one person that gets quoted by the newspaper if they're the only one that show up at the meeting. But if a bunch of us show up and give some rational testimony, like this. Hi, I'd like to, Mark Fenton, 25 Crescent Ave. I'd like to thank the chairman for the opportunity. And I'd like to support the board in moving forward with this section of the trail. I'd like to remind the board that although every American adult should get at least 30 minutes of daily physical activity, fewer than 20% actually get it, which leads to 365,000 premature deaths a year. I believe that if we put this trail in and kids can walk to school, or my mom can walk from her senior housing to that nearby pharmacy, that they will both live longer, healthier lives, and it'll be good for the community. Thank you very much. Did you hear what I just did there? Pretty good, right? Used my 3 numbers, got it in all under the 1 minute I'm allowed, and I didn't sound like a froth-at-the-mouth lunatic, which is who can often dominate these conversations if we aren't showing up to provide the rational testimony. All you people from the health district, are you hearing me? You can show up and you bring some authority to this, and you can testify as a resident. You don't have to be speaking for the health district when you say something like that, right? And, you know, you can just say, look, I live here, so I think it's a good idea. By the way, Columbus, Indiana did a beautiful job. They did a bicycle and pedestrian plan, and they not only built this comprehensive plan, but they voted it as a piece of their comp plan, so that now when a developer comes in and says, I'm putting my development here, you'll see how many dotted lines there are. Their core trail is fairly modest. It's just here in the core of the community. But they've got all these dotted lines out around the edge. And they said, so the advantage of that is when a developer says, I'm coming in to redevelop that parcel, they can say, good, you're going to do your normal sidewalks and you're going to build this section of the trail because it's on the plan, it's voted, it's ordinance. And that's just like you're going to put in sewers or the electric lines, any of the other infrastructure. That trail. And by the way, huge benefit to you because you're going to tie into this great network of trails. It's going to be a win for you. And it makes it actually easier because the developer's not getting blindsided halfway through the hearing process. Oh, by the way, we'd like you to tie into the trail too. They see that right up front, so they build that right into their cost structure and their engineering work. Do you guys know what the Bicycle Friendly Community Awards are? Are any of you aware that the League of American Bicyclists gives this recognition and that Ada County is a silver? They have bronze, silver, gold, platinum, I think diamond or something like that. Ada County already got a bronze, silver, and they have a Bike Friendly Campus Award. I think Boise State's a silver or bronze. But in any case, you've already been recognized for the good work that's been done in those parts of the community. But you're probably ready for the next level. Are people talking about a bike share system yet in Boise? And where's that conversation going? Yeah, the commies are. Yeah. And has it gotten any receptivity yet? Anybody else?
I think that it's in
Got
the
some
works.
traction?
I think they've gotten some money.
To move.
Yeah.
We funded it through the MPO.
You guys. And so you've a study, you mean, or an actual implementation?
We would buy the equipment.
From really? Are you using the B-cycle?
No, I'm not sure.
Okay, all right. But it looks like it might happen.
It's in the tip.
No kidding. Good for you.
Still has to be formed with
Yeah. You have examples from plenty of communities of your size, so you're going to be able to not make mistakes that others have. They have too many stations or too widely spaced. They know a lot now that they didn't know even 3 years ago. So you're coming in at the right time. And then the second thing I'll just tell you about Blue Island, Illinois, has a wonderful bike training program where they have low-income kids learn both how to ride and how to build and maintain a bike. And if the kid stays with the whole program, he walks away both with the skills, but also a bike and a helmet. But I've learned that you have a thing called the Boise Bicycle Project. Is anybody involved here? And just looking at your website, it sounds like you're doing some really cool stuff.
I just paid my son, actually, who's 13. He goes down there, he's built like 2 bikes.
I love it. I love that story. That's great. By the way, Boise State, it's interesting to me that they built this giant parking structure, but the most intriguing things in the picture are the beautiful pedestrian accommodations and the bike cycle program, which is housed right down in there. You know, the dream will come when we decide we don't need to build a parking structure, we'll just build a bike center instead. Or, as in the Netherlands, not making this up, they'll have a parking structure like this at a transit stop, 3 or 4 levels, and it's all bike parking. Literally, in Amsterdam, you can find a 3,000 to 5,000 bicycle parking garage. The hard part is finding your bike when you get in afterwards. But one of the things I did notice is that downtown touts, I'm staying at the Modern Hotel, which is right downtown, and in the little info brochures, you get first hour free parking, or, you know, they're really pushing the free parking, which is fine if that's helping the local businesses, but the long-term goal would be to have the parking be charged what the market rate is for it. That is, it costs some amount of money for somebody to build and maintain that structure, and there's an opportunity cost. If we tore that down, we could build something else there that we could make money off of, apartments, businesses. So those costs are being borne by all of us collectively if we're subsidizing that garage through our taxes. And indeed, what we're doing is subsidizing automobile use, right? So I'm a free market guy. I say, eventually what I want is the market to take care of itself. So I want you to have to pay what it costs to park there, and then you can think whether driving or walking, bicycling, or taking transit is actually the better thing. And, you know, lest you think I'm making this up, go to the New Yorks and the Bostons and Chicagos of the world, parking is absolutely prohibitive enough that there's no way I'm driving into Boston to park if I can use transit or any alternative. In fact, I am a member of our bike share program. I take the train in, and then I ride a bike share, Hubway it's called, to Tufts University when I'm lecturing there. Last but not least, safe routes to school. I'll just leave you the thought that this is a specific area of transportation demand management that shows real promise that largely has not been realized in the United States. I'm pretty frustrated. We do walk to school day events. We do kind of the things that have that short spike and then not a sustained effort. Has anybody been involved in safe routes to school or walk to school initiatives in your region? What have you done?
Nothing yet, but I will be.
Oh, how'd you get sucked into that? I mean, what's the nature of the...
I needed a job.
Oh, so are you doing that kind of work with who? What's the entity?
It's the Smart Growth, statewide nonprofit.
Got it. So let me make a couple of recommendations if I could. And you have a room full of people who will not hear this, and they're going to be your first go-to people. I would argue that we talk about the 5 E's. There's all sorts of content on that website. Have you been looking at the stuff? Are you familiar? Safe Routes Info is the National Center for Safe Routes to School. All right, but here's the point. I'll tell the story of Columbia, Missouri, very briefly, if I may. That's a walking school bus, a group of kids that walk a designated route to school with adult supervision, in this case, a University of Missouri student who's earning community service hours through the health program or whatever she's doing. Interestingly enough, at this school, the one that in particular I'm going to tell you about, they had such difficulty with the traffic at the entrance to the school ground that there were parents who wouldn't even let their kids walk with an adult supervisor. They wouldn't walk in the walking school bus because they were so concerned about the last 200 yards of the trip, the actual chaos at the school. And indeed, those parents, because they were within the non-busing zone, were therefore doing what? Driving and contributing to the very chaos they were complaining about. But it's a vicious cycle. I understood they were making a rational decision. While we did a walk audit, we did a walkabout near the school, we discovered there was this beautiful park adjoining the school grounds with this wonderful trail, this bridge over a little creek. And I said to them, they asked me to come back and help them design a plan wherein I asked, why don't the cars and the buses drop off over on the other side of the park, ease the traffic jam in front of the school, and then the kids who even come by car and by bus would get a daily walk. So now I'm talking about something very different than just a one-time event or something. I'm talking about a systemic change. I'm going to argue Safe Routes to School has only worked in the communities that I've seen around the country where they've embraced the idea of a systemic change and where the administration is on board. So I would go so far as to say, when you start working with the school, if you don't have administration buy-in, leave them aside and go to the schools that do. And do it there, be successful, prove success, and then move on. So, Safe Routes to School, I say, do it for a week. Have just a test where you do drop off on the other side of the park for a week. Then let's talk to the parents and the kids after the fact, and we'll see what they say. Okay? So they do that, and here's me doing a focus group with some of the kids. They just grabbed kids out of classes. They said, we're going to do a focus group with the young ones, the elementary ages. Draw a picture of your walk to school on the week that you were being dropped off on, your experience. Tell me a story about it, and get some feedback. So we had a great talk. We talked with the kids. They drew these pictures. They talked about the environment. This little girl, Sierra, talked about how her mom was nervous, but she said she could do it, but she had to hold hands with her little brother. So you can see in the drawing there, she is holding hands with her little brother. There's the trail. You'll notice every picture I show you has the bridge with the creek. All the kids thought it was so cool. They never knew there was a creek in this park right next to their school or a bridge on the trail. This little boy, Jared, said, some of the kids said they saw a bear in the woods when we were walking, but I'm pretty sure it was a dog. But that's his picture. You see the bear or the dog? Here they are walking, again, bridge, creek, Jared drew this one. These two kids were the total characters of they were the Mark Fentons of the class, T-Shawn and Khalil, total troublemakers, screwing around the whole time. This one's telling me about how his friend fell in the creek, which he didn't. So this one says his friend fell in the creek, which he did. You also notice that the picture here, that's the path, and there's the school in the distance, it's very small. Well, and I said, so why is the school so small? Why does the path get skinny? He said, it's called perspective. I said, oh, that's cool, I just didn't know that. So that night we're doing the big presentation, the public presentation. I've got all this data we've collected, trip data, but I'm also showing some of these slides. I've got a room full of school board members and parents, PTO, school administrators. So we're at the right level, right? We've got the right people to make policy level decisions. I'm telling this story, and as I mention this thing, this woman in the front row goes, oh my God. I said, are you okay? She goes, yeah. I said, what's the matter? She goes, I'm the art teacher. She couldn't believe he remembered perspective and used it in his drawing. It was like the highlight of the presentation. The principal says, see, Martha, your work it's resonating with the kids. It was, so we were talking about how great it was. This kid learned perspective and he used it in his drawing. Anyway, the kids told us how much they liked it. They really wanted to do it, but they challenged us. They said, one little girl, kind of quiet through the whole thing, Ariana, I remember her name, said, yeah, but is this thing for real? Like, are you guys really serious about letting us drop off and walk over from the... Because this was fun. We're telling you we liked it. But are you going to just do this like once in a while for a special event? Or are you going to let us do this? And that made the faculty and the administrators and all those parents actually decide to put together a plan that had recommendations like this. Actually improve the trail through the park. Plant a garden. Let's put in a community garden. In fact, this is all stuff they've done. Out of their recommendations, this has happened. They do it regularly. There is a trail through the park that's been improved now. They planted a community garden and a series of trees along it. And the biggie, they decided to put in place a 5-minute safety delay at the school on the motor vehicle traffic. Now you're nodding your head. Have you heard of this idea?
Yeah, I think it's a good idea.
It's a great idea. And the communities I've worked with that have done it have found it very impactful. Now think about what you're saying. You're saying we're going to freeze the cars at pickup time. We're going to let all the pedestrians and bicyclists and the buses leave, thereby eliminating conflicts. Because inevitably, if you don't do that, there's some kid trying to cross the street while some parent is frantically trying to get to piano lessons, right? And you're going to eventually have, so they hold the cars. Meaning the kids who were getting picked up at the school literally had to hang out in the gym. They started to hear kids say to their parents, well, you tell me, what did they say?
Me up at the park.
Do not pick me up at the school. Pick me up at the park. I hate it. They even said it with that tone of voice. The guys who go to the park get right out. I have to sit for an hour in the gym. It's a 5-minute delay. But to a kid, that's infinity at the end of the school day, right? It might as well be. So they literally have the kids harping on the parents, use the park, or let me walk with the walking school bus, by making the policy change. So we're at the base of the pyramid. Remember the pyramid? We haven't just done the nice walking school bus. We aren't just encouraging people. We've actually made the physical improvements to the physical infrastructure, the trail with the nice trees along it, and we've actually made a policy change. It brings us right back to our opening salvo, which says you got to use all those elements of social ecology if you really want to have community level, population level change. I'm really proud of that because because of that, not because of anything I did, because of what they did with that plan. Remember I said, sort of speak up, act up, step up. Step up is obviously the most obvious one, and I probably don't have to tell you, you're here. So I'm sure you look for opportunities, I hope, to walk, bike, take transit. I'd go a step further and say invite a friend to do the same anytime you can. Take a child, teach them how to use the transit system. I mean, whatever's right for you. But sort of, and people say to me, well, Mark, I live too far. I can't ride my bike to work. It's 20 miles. I live out in the country. So then don't ride your bike to work. But when you're at work, could you sometimes forego a car trip and walk to the post office rather than get in your car? Just look for the little opportunities to be a piece of the change, to populate the landscape with bicyclists and pedestrians and transit users again. Lots of reasons we should do this stuff. I didn't mention it, but we kill about 4,000 pedestrians every year in the United States. Closer to 40,000 die in motor vehicle collisions every year in the United States. Those are fairly static numbers. We've not measurably changed those in any dramatic way over the last decades. And closer to 400,000 due to sedentary living and poor nutrition. Those are sort of scary orders of magnitude when you think about it. You could talk about our dependence on oil. You could talk about safer streets, more livable communities, where employers want to locate. When they're looking at their list of livable communities now, and Boise's on the list now. There's the Portlands and there's the Boulders and there's the Davis, Californias, and yeah, Boise's on the radar. But you guys are going to make a decision about which way you go. And I think it's still, the jury's out. Not because of Boise proper, but because of the region. You got some really important decisions to make and some very sort of, I think, very real challenges that are not trivial. But the real reason to do it, I think, is well illustrated by this woman I met in Plainfield, Indiana. So I'll tell you my last story. She's walking across a bridge on a trail system, not unlike your Greenbelt, small town outside of Indianapolis. And they've just put this bridge in that previous summer. So I'm taking pictures. I say, do you mind if I take a picture of you coming across the bridge? She goes, no, go ahead. I say, so what do you think? They just put this in, right? She goes, oh yeah, it's been a lifesaver. Lifesaver? I mean, it's a bridge. I mean, it's a nice trail. She said, well, we're kind of going through a tough time. And then she offered the story without, I was not pushing. She said, my daughter, Sarah, the girl on the back of the bike here, is being treated for a form of childhood leukemia, I think she told me, but it was a treatment she could reject it unless her immune system was suppressed. In taking those drugs, she's vulnerable to things like a common cold. So she doesn't have her playing with other kids and stuff. She says, the one time in the day she's kind of comfortable and happy is when we're riding on the bike. She doesn't feel like a baby in a bubble because I can ride to the park. She can see other kids. She's out in the world. But I would never do this if I had to ride along a really busy road. But because we have these nice trails, I ride on the trails. I can go nice and slow, keep her comfortable. It's great. And as a parent, you know, I'm thinking I can't imagine how stressed I'd be, sick child. The notion of having a moment where my kid's on the back of the bike and giggling and laughing and talking with me, she's telling me the story, I'm thinking, wow, you know, I get it. It is a lifesaver. But when I think about that story, I realize that it's not just about little Sarah. She's a euphemism for the elderly shut-in, the woman whose kids are deciding whether now that mom can't drive anymore, whether we have to take the keys away, and whether we have to put her in an institution because she lives in this house where she can't get to anything without crossing a big dangerous street. Maybe she's got a nice trail that connects her to this community center, which they have, and has senior programs. She can walk to it safely, and we don't take the keys away, and she still remains. She's able to live in the house that she's begging us to let her spend her last 5 years in, right? Or she might represent the latchkey kid, the kid whose mom, single mom, working 2 jobs, and when he comes home from school, she says, you get inside the house and lock the door so I know you're safe. I've got to be at my other job in the afternoon. You know how that works. But now maybe that mom can say to that kid, look, if you and 2 of your buddies want to walk down to the soccer fields together on the trail, not on the road where it's busy, go walk on the trail, take your cell phone, you call me when you get there, I'll let you guys do that. So that kid's not just sitting in front of a television screen, right? Every time I make myself put this picture in a lot of my presentations to remind myself, that's Sarah, but that's who she stands for. That's why we have to do this stuff. This is about a social norms change on a massive scale. It's not just about dumb sidewalks. It's about how we shifted over the last 40 or 50 years and what we have to do to swing back. And I know you guys get all of this because you're here, right? So I'm talking to the choir, and I can't thank you enough for that. But if you get a little info, if you get a little ammunition from what we've just talked about that you can bring to others, then that would be a good thing. Because I tell people the reason I'm a raving lunatic about this is quite frankly not for any of you who seem like nice people, but I don't care. You're big boys and girls and you can make your own decisions. I really don't. Do what you want. I don't care. It's for Sarah and for my kids, who are now 15 and 17, but I've frozen in time at 3 and 5, to remind me that they're the first generation in modern society that's going to end up with shorter life expectancies than their parents, which is an unfathomable sin for one generation to commit upon the next. And it's absolutely going to happen. It's combined physical inactivity and poor nutrition. But I believe a strong contributor is the fact that they don't live the same free-range youth that we did. And I think we can do something about it. And I think the built environment has at least enough strong influence that it's got to be one of the things we fix. So that's my story, and I'm sticking with it because I think the evidence is there. And I'm happy to chat with you some more about it. But I'm also going to remind you there are good snacks in the back of the room, including cookies, and they have to be eaten before you leave. That's right. A lot of good fruit back there, too. So thank you guys very much, and I'm happy to take questions, comments, thoughts, protests. And I wish you luck in the good work that you're all trying to do. Questions, thoughts, comments?